Hello friends, I am Dr. HAREESH KV, the Chief Consultant of Abhishek Nethradhama Eye Hospital. During this unprecedented period of Corona, another disease which is making us anxious and worry about is black fungus. And I am here to share few information about the black fungus. Let us begin with the sequence of symptoms and signs in cases of mucormycosis and the route through which the mucormycosis attacks our body. So it travels through the nose to the paranasal sinuses, then the orbit, then the brain. So let's try to understand what are the signs and symptoms when it is in the nose. In the early stages, when the aspergillus or mucormycosis is affecting the nose, you might feel the stuffiness of nose or blockage. You might have discharge from the nose. Look at the discharge. So if it is very sticky or mixed with blood, or if you see some black spots in it, probably it could be mucormycosis. Sometimes if you look at the nose, you might see some red spots there which will turn to blue or black. So these are all the early stages at which you have to approach the ENT specialist. In the next stage, it will attack the paranasal sinuses. Let us try to understand what are the paranasal sinuses. In medical terminology, para means adjacent to or beside it. So beside the nose, we have 4 types of sinuses. Sinuses in the sense hollow bones having the cavity inside. We have frontal sinuses just above the eyebrow, and maxillary sinuses near the cheekbone, and ethmoidal at the root of the nose, and the sphenoidal sinuses. So once the mucormycosis attacks the sinuses, you might have swelling over the eyebrow area or the cheek area, and this is the stage where you will experience fever and body ache. Since sinuses share the common wall between the mouth, so you might see some black spots or red spots here. You might experience the toothache, tooth might loosen up, or you might feel severe shooting pain in one side of the face. On the certain occasions, when the mucormycosis affects the sensory nerves, means the nerves that carrying the pain sensation is affected, you might feel the numbness around the cheek area. So this is the stage where you need to approach the ENT specialist or a nearby eye specialist to pick up these findings. So you might have the sinus tenderness in the sense you might feel the pain if you press over these areas, over the sinuses. In the third stage, the orbit is involved mainly because the orbital wall is a common wall between all the 4 sinuses which was talked about earlier. Orbit is a cone-shaped bony socket holding the eyeball and the important structures that are required for the eye. As you can see here, bottom of the orbit is crowded with lot of nerves and blood vessels which are required for the eye. Once the black fungus enters the orbit, it specifically involves the blood vessels and the nerves which are behind the eyeball. Hence, the symptoms are basically you might feel pain behind the eye, around the eye, and you might have the swelling around the eye and the difficulty in lifting the lids, and the eyeball movement will be restricted so that you might feel double vision. And in later stages, if the blood vessel which supplies the eyeball is affected, the vision might also be lost. In the 4th stage, the infection might spread from the orbit into the brain through the bony openings, or sometimes it might directly affect the brain through the sinuses. Once the black fungus affects the body, the treatment mainly involves the surgical debridement, in the sense removal of the damaged tissue. It is of utmost importance to recognize the disease very early. The reason for the sudden increase in the mucormycosis is mainly because of the uncontrolled diabetes and steroid usage in the corona patients, and the vast number of cases of corona that is affecting the whole of the world. Does black fungus affect all the corona patients? No. Going by the statistics, in India we have 2 crore 80 lakh people who have been affected by coronavirus, but only 10 to 11,000 of mucormycosis have been detected. In Karnataka, we had 25 lakhs of people affected with corona, but the recorded number of cases of mucormycosis is 1,250. The mucormycosis will not affect the healthy individuals. It will affect only the immunocompromised or the people having uncontrolled diabetes. Diabetes per se is not a risk factor if it is under well controlled. So one word of caution: many people, because of the steroid injections or steroid tablets given during the period of corona, are going back home. Keep a check on the blood sugar level, keep it under control, and you can be safe from black fungus. Many people are taking steam inhalation for the prevention of black fungus or corona. Many ENT surgeons have expressed their concern regarding this. Because of the water vapor, the immunity of the airways will go down, and there are many chances of inhaling these fungus along with the water vapor. And take care about the mask we use. The moisture in our breath can get accumulated in the mask and can breed many bacteria and fungi. Hence, wash the mask regularly. If you are using the cloth mask, dry it in sun, then reuse it. Take care of your food habits. Eat healthy, stay healthy. Keep your surroundings clean and quite well ventilated so that the fungus will not breed in your surrounding. As I explained earlier, mucormycosis affects the back of the eye, and we are going through the season of allergy, and you might experience redness or watering, mainly because of the change in weather or a viral infection. Don't panic if you are having a small itching, redness, watering, and if you don't have the other symptoms. Don't be very anxious, and the fear itself can bring down the immunity. Black fungus is still a rare disease. It doesn't affect all the people who had corona. Stay healthy, be cautious, don't be anxious, but keep a watch on the early signs of mucormycosis. Thank you.